I'm Dr. Qazi. I'm over in Newport Beach, California. I do skin restoration. I work a lot on sculpting patients' faces. And today I'm going to showcase something that I don't really talk too much about, but that's something that I love to do, which is a liquid nose job. So you could take a look and see that process right here where I worked on this patient to help out with the bump on her nose. It was something that she was feeling self-conscious about. Really nice improvement. Just probably took me like 5 to 10 minutes here. So it's a fast procedure, relatively painless, and really amazing results just immediately afterwards. So I love it. It's one of my favorite go-to results, really. I should say, just because one of these things is that sometimes I just want patients just to feel really good about themselves. And a lot of times people will say, well, they can't afford surgery, or they want something that's a little bit faster, no downtime. And that's where something like a liquid nose job could work out really well for them. So if you look at this particular patient, she's in her 50s, and just her nose was bothering her for a while. And so it was nice to really just be able to kind of help out with her and just improve her confidence immediately. You know, she was just like beaming. She was just super happy with what we were able to do. So we worked on that hump for her, and then we also helped sort of straighten out her nose a little bit and also just lift up the tip just a little bit as well. So it's not really for every single patient. Part of what I'm going to talk about is that tonight. So I'll put that up as a text over here. So who is a good candidate for a liquid nose job? So I'll put that up as a text over here. And really, it's more about the kind of nose that you have. I want it so that there's less of that bulbous tip. If you're trying to lift up the tip, that could end up making it a little bit too wide. But for patients, especially when they have a hump, it works really well. And if it's relatively thin in the tip area, then I could lift it up really well. So it sort of just depends on what we're looking at in terms of the skin, how thick the skin is, and overall what we're trying to achieve. We could definitely get there. It's just a matter of just kind of working with you and making sure that we could achieve the best possible version for you, what the aesthetic you're trying to look for. So for myself, I view this as something that's really great for a lot of people, especially when they're for their profile. You know, I do their chin, sometimes I do their lips as well, and then I do their nose, and you can see everything really well there. Minnie saying, I'm set to get rhinoplasty in 6 months. I have a question for you. I asked my doctor. Let's see if I can help you with that, Minnie. I'm missing the question there. Smiles is saying, what do you think of manual extractions for comedones? I think it's okay if it's done properly, but usually it's a little bit too high risk, so I wouldn't really recommend that. Depends on where you're going. If it's a physician's office, that's a little bit different than potentially some other people who just use certain tools which may not be appropriate for you. So I guess really the answer is it depends, and who's doing it and how they're going to do it and how comfortable they were doing it. I really don't want you to get scarring for something like that. Let's see here. Minnie's saying, I'm trying to narrow the nose bridge. My nose is really wide on top. Well, we could do that with filler, but if you're talking about you're getting a rhinoplasty, then that's something that they would be able to do at that time. I don't do rhinoplasty. I don't do surgical rhinoplasty, so I'm a little bit like out of my depth with answering questions with regards to rhinoplasty particularly. What I really do is just do non-surgical rhinos. My partner does it, but I wouldn't be able to answer that particular question for you. Do you trust estheticians for extractions? I guess it depends. I probably would prefer if you go to a physician that could basically sometimes burn things off and just be really careful, especially with causing potential scarring. I've had a lot of patients who've gone to estheticians before. I'm not saying that estheticians are bad per se, but I had a lot of patients who've had that, and they ended up getting scarring. And sometimes I even see like the nail marks of the esthetician as they did extractions. And when I'm working on their scars, I see like it's clearly from nails. And you talk to the patient and they say that, yeah, they went to estheticians, they did facials, and the end result is basically now they have a newer scar, not just the old scar, but on top of it they have this nail mark inside there. It's dug inside there. Do I recommend Morpheus 8? Well, it depends. For skin tightening, yes, it works really well for skin tightening, but not so much for scars. But for skin tightening, it's a great option there. Do I know the rough average price for a rhinoplasty in California? I would say it's anywhere from like, probably $10,000 to $20,000 typically. Let's see here. Mel is asking, who is your partner who does rhinoplasty? Dr. Kalari, she's a plastic surgeon. So she does our rhinoplasties for us. Let's see here. Price for a rhinoplasty. So this is basically a liquid nose job over here. So this is what we do is on our page. It's about, I believe, $1,200 with us for a liquid nose job. Let's see, user 4087 saying Morpheus 8 is not for skin tightening over 50s. I don't disagree with that. I mean, I typically don't do it actually for patients, especially 55 and above. Usually I end up recommending other things or potentially just surgery. So I think you're probably right. Especially, and sometimes it could be even younger. If somebody was on Ozempic, any of these other GLP-1 inhibitors, and they lost a lot of weight, and now they have more of that sunken look, you're really not going to be able to get enough skin tightening with something like Morpheus 8. You likely are going to need a facelift and neck lift. Let's see here. What do you think about going to Mexico for it? Are you talking about for rhinoplasty? Honestly, there's a lot of good physicians over there as well. It's just there's a lot of different things that we have to pay attention to though in terms of follow-up. I deal a lot with scars, and so I see a lot of times scars, and if you ask the patients where they went, a lot of times it's overseas, things like that, so they didn't really get good continuity of care. And so things like that really do factor in, especially when you're talking about surgical type of issues. You got to make sure that there's a good follow-up and making sure that the patient's healing appropriately. And when you're looking at this, somebody goes overseas or goes down, not necessarily just goes across the border to TJ, it's difficult to kind of just have that continuity of care. And sometimes that's the difference between like a really healthy result or something that gets a lot of scar tissue, things like that. So, that's what I'd be worried about. For those just joining, I'm Dr. Qazi. I'm over in Newport Beach, California. I do a lot with skin restoration. I also do a lot with facial balancing. So if you take a look over here, what I ended up doing, this is a liquid nose job. So I did filler in the tip of her nose. I also did it in the bridge, and also just really help straighten it out as well. Just that bump, and just try to make sure that everything looked really, really aesthetically pleasing for her. So she was really concerned with her side profile. Something that she was trying to shoot for a long, long time was just to be able to improve the bump on her nose. She definitely didn't want to do surgery, but we were able to get the aesthetic that we wanted just in a matter of a few moments, and just with filler. Let's see here. Lynn is saying typically there's doctors won't take time to extract. Our incision here and never extract with nails. That's a good point. Never extract with nails is a good point. But like I said, there's some estheticians who've done that. But you don't necessarily have to extract with that. Sometimes you could use I actually use my erbium laser sometimes just to blast closed comedones, or I could use electrocautery like a Bovie. So could we do that as well? Mike is saying, can derms get rid of fibrous nose papillas or plastic surgeons? Either can we do it. I do it myself also. I do a lot with that as well. So just go to somebody who works on it. Just like ask them if they could do it. I definitely do a ton of it. Really, I wouldn't say every day, but probably every other day I do it. It's pretty common, especially with men. I'm not sure if you're male, but I do a lot with that. Yasmina Gonzalez saying, thoughts on halo laser. What are you trying to solve with the halo? I guess that's what matters there. Delusional Thomas is saying, I have ice pick and box scars. What is the most effective treatment? I have a consultation with you. Okay, so ice pick is almost always going to be something like TCA Cross, excisions. Those are probably going to be the best option. If the boxcar scars are relatively thick around the edges, then you're likely going to need to do laser. We probably will want to do something with Subcision or like Bellafill, for example, for the boxcar scars. It just depends on how deep the scar is, though. Do I treat active cystic acne? Yes, we do. We also do it with the Cure laser. So we use the Cure laser. It's just been incredibly successful for us. We ended up basically combining it sometimes for some patients, especially when they're very active acne, with broadband light. Works very well. Just basically kill that surface bacteria. And then essentially we basically could use topical antibiotics while it breaks people out. So if it is breaking you out, especially during the purging process, what I would recommend is we could do the broadband light therapy. That's going to usually kill out some of that surface bacteria, or we may need to be like an oral antibiotic for a short burst, topical antibiotic. Those are different options that we could do. Usually most patients that haven't found it to be breaking out too much, we also want to see to make sure that you're not doing really things that are overly exfoliating the skin. So I tell patients all the time to hold back on benzoyl peroxide, salicylic acid, glycolic acid, tretinoin. Usually want to hold back on those things while you're doing the acure laser, but that could potentially be a good option. Or we could also consider just doing oral medications. Or I like for women, spironolactone works very well. If it's not really terrible cystic acne, it's just hormonal, just like during your period time, it can work really well. Just a short burst of topical antibiotics. A lot of times, something I use is Dapsone, works very, very well. We could, of course, do isotretinoin. I have a lot of patients on that as well. So it just depends on what you're trying to do, what you're trying to shoot for, and essentially what kind of results you're trying to get, and just your tolerance for side effects. Hart is saying, how do you get rid of acne? Well, it's actually a really good question, a really broad question, but it's a really good question. And it's really shifted a lot over the years. When I was growing up, it was basically that there was nothing you could do. It was like basically, genetic, and nothing you're doing environmental-wise, diet-wise is affecting it or causing it. And it turns out really that's not so true. Really, we know now that dairy certainly can trigger acne. We know, for example, that certain foods can make things worse a little bit, where you potentially could get more oil production due to a certain food. And so now we kind of counsel patients about those type of things and making sure that we could cut back on that before we go into doing more aggressive treatments. Have you tried those things? Are you doing those things? Also, of course, if it's like, cystic, if it's just small cystic lesions, you probably need to be on some sort of antibiotic. Some sort of topical antibiotic is going to be a great option for you at that point. You could also do like a sulfur face wash with it. So sulfur with like a topical antibiotic like clindamycin, or usually my go-to is Dapsone. Those are all great options there. So it sort of all depends on what kind of acne you have. If it's really severe, then you likely need to be on isotretinoin, which is a brand name like Accutane, or you could consider doing the Acure laser, which works just like Accutane. Let's see here. Someone was saying that they're purging from their last Acure session. Usually it will last just for about a week. How long has it been lasting for you, period? And did you talk to my office about that? We could take a look and see. Hi, saying, can I use tretinoin and benzocaine during acne scar treatment needed for clear skin? Usually I put you on a different topical for prep, and then what I end up doing is I may have a topical antibiotic, but I do want your acne to be probably better controlled though. So if it is controlled with that, that's great. But we may want to be on a topical antibiotic while we're doing this though as well. And I know you're on the benzocaine, but I may just do without the benzene and just do clindamycin for a short period of time, or Dapsone potentially. Period is saying that they've been purging since the beginning of October. So we could take a look and see if we need to do any topical or oral antibiotics. So just go make office a call tomorrow. But usually we should be not having that prolonged with any purging after the Acure laser. It's very, very rare now at this point to having patients with prolonged purging. It's usually just a matter of a little bit of time now. User 36 is saying, how long until your patients see dramatic results for acne scars like some box scars and ice pick scars? Ice pick take a long time. It really does. Ice picks could take actually 1.5 years to 2 years to see dramatic results with that. It's a very slow process. I have told patients before, sometimes it is a matter of people's ethnicity, though. I do find that certain ethnicities do have a more robust collagen response with TCA Cross, with their ice pick scars. Sometimes it looks like some of their scars, just after about 6 months, it's like very, very minimal, almost gone for some of those scars. So it sort of depends on that. And then also, the other thing that matters is sometimes patients' weight. If they're smokers, those are all things that really we should really pay attention to. And then their diet also. If they're having a lot of oil production, if they have acne-prone skin, all those could factor into to causing poor results. Carlos is saying, hi, Dr. Qazi, how long does nose filler last? Usually it's about a year, usually 1 year. We do actually include, with our nose filler, we do include a touch-up with that. So just so you know, there is a touch-up with that. Let's see. Albede is saying, is one session of subcision fractional CO2 laser effective for boxcar and ice pick scars? Well, it's going to improve it, but whether it's completely effective, I wouldn't really say it's going to be completely effective for that. It's going to improve it though, but we have to take a look and see how deep your scars are, and maybe you have to do excisions, things like that. Our ref is saying, what ethnicities don't respond as well to acne scar treatments? It's not so much that they don't respond as well per se, but they just don't have as fast of a collagen response. I do find that certain ethnicities just have a faster collagen response than other ethnicities. And I think there's other factors though, like I said, oil production, the thickness of some people's skin, their diet, I think that sometimes weight, all those things also factor in there. Angie's saying, do you use XLV for red incision scars? I do use that for that. Yes, I do. Absolutely, we do. I love that actually. It's a great product for a lot of patients because there's not much heat with it. So you could do it and just localize the energy at a spot, and it's really cold. Contact cooling works really well. Appreciate you, Tears Agisha. She's saying, love you, love all this knowledge. You are like an encyclopedia. Appreciate you. Let's see. JFK saying, I have scars on my face long ago. Can they come off? Yes, I can help you with that. Thumbs up is saying, I wish I could come to you. No one seems to be as knowledgeable of my kind of scarring in Kentucky. Actually, I just had a patient from Kentucky, a really, really nice patient. She was here just like last week for her second step. Her scars are almost gone right now. Just so you know, she's really, really happy. She has a bit of a testimonial where she spoke about it just when she came in. Really happy to do it. She was talking about it. Really appreciated her too. I don't know if you're on right now, if you want to tell, kind of reach out to this patient. But you know, I do a lot with people from all over the country, and I'm happy to do it. I'm happy to get excellent results every single time. And we really can. It's just a matter of just like follow my instructions, go through the process, make sure you don't smoke, make sure you quit smoking. Big deal. Don't pick up smoking again. Quit smoking before you come to me. Make sure you don't smoke afterwards. Like that matters so much, honestly. Smoking is probably the biggest barrier for collagen response. It really is. Acne, of course, is as well, but smoking is such a huge issue. Pamela is saying, is there a wait time to schedule an appointment with you? You could go through my page at drqazi.com and just schedule a consultation that way. We'll be happy to help you with that. All the best is saying, for acne scar and skin brightening, is salicylic acid or niacinamide for oily skin? Both are okay. I would probably do niacinamide, and then you could do like glycolic acid once a week, and I would probably do some sort of retinoid. You could just do different. If you just want something over the counter, just do different there. Do you have payment plans? Yeah, we actually accept everything. We do Cheery, we do financing with a firm, we do financing with really everything. So we take everything. Actually, right now, Care Credit and Cheery definitely it's probably the most popular thing that everybody's doing. So just so you know. Let's see here. Is it true tretinoin has BHT and it's bad for you? I haven't seen that before. I'm not sure about that portion of things. I'll take a look and see just to give you a good idea for that. How do you use a topical clindamycin before moisturizer? Yeah, you basically always want to use your antibiotic as a base before doing it as before using a moisturizer. But I'm glad you're doing it with the moisturizer. In my time, everybody decided just to dry up your skin a ton. I think it made acne worse. I really never loved that. So just so you know, it's it's just something that I'm glad it's the pendulum has swung now back to just allowing people to moisturize. I think it's really important, basically. Let's see here. All the best saying, I use glycolic acid every day. Is it good? So you could do it, but I prefer just once a week glycolic acid and do a retinoid every day, and that's probably better. Sailor Cherry is asking, are you married? Someone else is saying I need work done. So I guess it's kind of a mix about which way I should go. Let's see here. PRP for hair. Yes, it's awesome for hair, actually. I do it myself for my own hair. I'm 42 years old. I was having hair loss really by the time I was 28 years old, a little bit. And mostly I was doing topical minoxidil. And it was kind of protecting it a little bit, but it didn't really help too much. And then I was getting chunks and chunks of hair in the shower. And I ended up doing PRP, and it basically saved my hair. So it's I had more hair growth. I now don't have any chunks of hair in the shower, which is really nice. I caught up on that, so which is really good. I kind of look like Bruno Mars. Thank you. I actually, I met him actually one time. He's a really, really nice guy. Really, really nice guy. Joey saying, I just didn't excited to see my hair stay in my head. Awesome, Joey. Hope that helps you out in the long term. Let's see here. How do you treat hyperpigmentation on brown Latino patients? I show a lot of those results. Actually, take a look at my page. I'll do another one at some point right now, but basically I do a lot with the Pico laser. That's what I do. I do a lot with the Pico laser with that. Let's see. I know I missed a bunch of questions here, so I'm going to try to hit some of these here. Let's see. I'm going to try to scroll up. Actually, I know I missed a bunch of people. So if I missed you, just please redo that question. I'll be happy to answer it there. Let's see. Does tretinoin also help with hair growth? There's a little bit of evidence with it, like kind of anecdotal. I think pretty poor studies though at this point. But honestly, topical minoxidil is okay. It's not the best, but it's okay. I probably wouldn't add tretinoin because I don't know if there's enough of the evidence to really showcase that it helps. I do oral minoxidil. It works really well. It's just the only problem is that you do get more hair growth elsewhere. So it's a problem for women, for men that aren't used to like excess hair. It's a problem. It's a funny story. Actually, I'll tell you guys actually something interesting. Sometimes people comment on this. I'll tell you. So I actually, partly because I was doing oral minoxidil, I started to actually do a little bit of laser hair removal. So you can hard to see a little bit patchy right now. That's actually the process right now during laser hair removal. Actually, I'm doing that actually right now. I'm not trying to remove it per se. I'm just trying to reduce it because it was just so thick. Like literally I would shave and like an hour later I was getting a beard, especially because it was like the minoxidil. And so I like this. I like it's just like I like that more like clean shaven look. So that's why I'm doing it. Although right now it's kind of still in this patchy process. So like right now in this there's like this period of time where it's like you're gonna see this like kind of patchy and blotchy. Some of my patients that have known me for a long time are like, "Are you getting laser hair removal?" It's like, yes, yeah, that's what's happening right now because they're like, "What's going on with your the patchiness?" I'm not like always missing my like the same spots with a razor blade. Just so you know. And I do kind of go with the same kind of look as hers with the curly hair look here. How much is this filler? It's our prices are online actually. I think it's $1,200 for nose filler. Hi Kimani, how's it going? Let's see here. I know I missed a bunch of questions. Sorry, my dog got a little bit. She wanted some attention for a quick second. There you go. Can diabetics get a phenol peel? Well, if it's under control, yes, you could. Yes, if it is under control, you could. It just depends. And also what your skin type is. Can microneedling help reduce very old hypertrophic scars? No, really, it probably could actually make it worse. I would not recommend that. Are V-beam results for PIE immediately? No, it actually could probably take about 6 weeks. It takes a while, basically. Basically, what happens is that you destroy some of that vessel, the broken capillary, and then it gets reabsorbed by your body, and that process could take several months. So it's not right away at all. Let's see here. Could you do any treatments on the consultation appointment? It depends. What are you trying to treat, user 36? Let's see here. Can you do laser hair removal while on Accutane? We can in our practice because we're comfortable doing both, but it just depends on where you're going and what wavelength they're using and making sure that you're going to be really good about sunblock afterwards because it is, with Accutane, it will really, it's something that's going to make you really sun sensitive. So we want to make sure that you're aware of that and you're putting a ton of sunblock even on the body, like your clothes are not covering up there. Let's see here. Marissa is saying, I've been using silicone sheets on my indented scars and have noticed it does help. It does, right? It does help. Sailor Cherry is saying, I'm coming to LA in December from Hawaii. I wonder if you ever come out here. Actually, I just had a couple weeks ago two patients that came from Hawaii, actually. Really amazing mother-daughter team, actually. It was really, really nice. So I have a lot of patients there. I actually, unfortunately, do not go anywhere else, at least at this point. I want to make sure that we just do everything at a really high level. My team's amazing, and I just like having like everything that I need right here. So I don't go out because I just want to make sure that when I do it, it's like done really, really properly. We're just 5 minutes away from the airport, by the way, just like literally right here. So we'll be happy to see you when you get here, but I try not to say that I'm going to be somewhere else also because I just don't really see it in the near future right now. Let's see. Prob is saying, how do you treat hypertrophic scars after cortisone shot? You really should do silicone sheets after that. Jaja is saying, what options do you have for patients who do not want to do lasers for acne scars? Jaja, it depends on what kind of scars you have, what's happening. Maybe you don't have to. I don't have to do it on every patient, number one. But also, why are you so worried about lasers? I think that's the bigger question there. Can rheumatoid arthritis patients get a phenol peel? Good question. Doubt it because you're usually going to have to be on immunomodulators, and now the risk is not going to be worth it really because you could potentially get a bad infection then. So it really would be less likely to do it with a rheumatoid arthritis patient. Let's see here. Thumbs up is saying, is it smoking, vaping of any kind, or just cigarettes which prohibits the process from working? I know, I love that question. I appreciate that question so much because it's really important just to kind of pay attention to something that happened over the few years just between, all of you guys, even young patients right now that are on here, all of you guys really saw the propaganda machine of the cigarette companies work so well in shifting cigarettes to vaping and making it seem as if vaping was a healthier option and it's a safer option. When in fact, it actually could be worse for some patients. It could actually cause worse pulmonary fibrosis in some patients, but it's certainly going to still cause significant lung damage. And overall, for my purposes, it's problematic because it's bad for collagen production. So there's no question about it. Either option is really bad. And it's really unfortunate how they shifted this whole thing and made it seem as if vaping was some sort of like this healthier option out there, when everything now showcases that it's just as deadly as cigarettes. But the industry spun it so well and so successfully that people got so convinced that it was superior to cigarette smoking. One is doing just the same damage to you. I'm so shocked that they were able to do that. They pulled it off. They were dead in the water. No one my generation was smoking. By the older generation, a few years older than me, I would say not even the older generation, just a few years older. A lot of those generations, they were smoking a lot. Some of you guys may know. But when I was younger on the plane, it was like the smoking section was just like a seat behind you. It was like ridiculous. Like you're sitting there as a little kid and someone's smoking right behind you. And then you say, well, I want to have someone non-smoking. They're like, you're in the non-smoking section. Literally one aisle in front of the smoking section, and that was acceptable to people. And then it's totally there's a huge cultural shift, and everyone accepted that it was terrible. And then what they did was basically went on this marketing spree where they went crazy and pushed vaping as if it was this alternative. It's crazy. So vaping is terrible for our purposes. If we're talking about for scars, for healing, things like that, terrible. So do not you have to stop vaping. You got to stop cigarette smoking. Smile is saying, if you have a breakout after scar treatments, can you decide to do a cure then? Yes, you could. I do have some patients that have done that. And certainly, actually, it's been good because it's sort of saved the fact that they didn't end up having significantly long cystic acne afterwards. So, which I'm glad that they reached out to me to get that helped out with it. Thoughts on Aroslo versus tretinoin? Either one, whatever one is being comfortable, is being covered by your insurance. Typically, for my patients, I usually use tretinoin just because it's easily covered. It's just something that's generic, cheap. I like that for patients. I'm not somebody who tries to sell it in my office, anything like that, because I just want people just to get it, and they don't have to spend a lot, and it doesn't break the bank for them. And I use I've used tretinoin really since I was probably 16 years old or so, and I know that it's just amazing. So I love tretinoin. So that's kind of the bias that I really have. Tazorac I found was a little bit too irritating. At least that's what I felt. I felt like it was a little bit too irritating for my own skin. So that's why I never really loved it as much. But I know some people like it, so I don't really push it or anything like that, like to say tretinoin versus Aroslo. But my own sake, though, I found it was a little bit too irritating and drying for me. And that was my own growing up. And so I ended up switching over, and I always felt that every time I was like, here, okay, why don't you just try Tazorac, just try it. And so I'll do it again, and then I'll break them out even again. So it's I never really got out of that purging process with it or anything. So I was like, you know what, I'm just going to stick with tretinoin. So that's honestly all it comes down to for me. But I know there's a lot of patients who swear by it too, and work sure it's great. I'm like, that's totally fine. It's I have no problem with that. But personally, when I prescribe things too, I usually prescribe very low dose, dose tretinoin, like 0.025 or so. Usually that's what I end up starting out with there. Ashley saying, thoughts on spironolactone for acne. It's awesome. I think more women should be on it. Really, it's a really, really great option. If you're not planning on getting pregnant anytime soon, it's a really good option there. It's just the barrier really would be if you're planning on getting pregnant soon. Sabrina saying, do you have any solutions for pigmentation changes after liposuction? I have what looks like modeling under the skin. Well, if it's modeling, it's a little bit different, but if it really is just pigmentation, then what we may want to do is Eucerin's anti-pigment cream. That could be a good idea, and then we could combine that with like a pico laser. Usually I use a lot with the pico laser for that. Let's see, your F is saying, what age do you recommend to start doing PRP? What kind of treatments do you recommend to do at 25? It just depends on what you're seeing. I'm not sure what's actually happening with each individual skin. So it's like, it doesn't matter how old you are. If you're someone, I had an 18-year-old who was losing hair. You checked all the labs, everything is fine. And so now it's like, why don't we just go ahead and do PRP? And he's getting great results actually with that. So there's no problem with that. User 65 is there an expiration for your pigment control cream? No, I think it's 2 years actually. 2 years. I think it's going to last you a while there. Honestly, it'll last you a long time, that little bottle. Let's see here. I think it's all is saying my morning all the best. My morning routine is cleanser, vitamin C, and sunscreen because I have oily skin. Is that enough? Yeah, that's perfect. That's great. Do that. I don't really love vitamin C per se in a lot of acne patients, though. I know it's a little bit, a lot of people say, otherwise, but like personally, I found it to be irritating. I found it to sometimes break me out, things like that. So especially I'm a man and while shaving, I was burning a little bit. So that's why I didn't really just insist on that. But, I know it works great for the right patient too. It's like, especially if you're mixing with a nice moisturizer afterwards. How long to see the laser results, laser treatment results? It's slow. It's usually like 6 months or so before you see that collagen results. Initially, after the first month, it's going to feel softer though, but it's going to see going to get better and better over time. Ashwant is saying, I got 0.25 tretinoin in the UAE. When should it be safe to increase the concentration? Well, it depends on when you started it, but you may need to do it just after a few weeks. You could just go ahead and increase the concentration. Although, like personally, you don't have to increase it. It's just like if you have oily skin, things like that, then you should increase it. ABS saying, nothing you can do much moisturizer and be sure to use sunscreen next time. Thank you. Yes, I'm not sure what you're referring to, but that's right. User 57 saying, Moxie laser good for pigmentation, even texture. What skin type are you? I think that's the answer or the question. Is there any way to dissolve radius? No, I've had a lot of people that come to me before with radius that was like hard. I hope that didn't happen to you. Very, very difficult to deal with. Sometimes what we could do is actually break it down a little bit with Subcision, but it's tough, honestly. Subcision, a little bit of steroid sometimes could work, but it's a tough product though, really tough, and that just disperses it. I tried everything. I've tried what they sometimes recommended, which is sodium thiosulfate. It didn't feel like it helped. Tried just normal saline too, or sterile water, all those things. Nothing really helped with that. For Moxie laser, skin is Asian. That's probably okay, although I've had some patients who've done that before and they've gotten post-inflammatory hyperpigmentation. So be careful. I'm not sure how comfortable they are, the place that you're going to for it, but it's a pretty easy laser too for people to use. So I generally think that that's something that's going to be difficult for somebody to mess up with. Although I did have somebody who, they had done a halo laser, which I also think is pretty easy to use. And the person was like digging into their skin apparently, and like when they're doing it, and she had terrible burns from it. Really terrible. It's like you could just see it, like it was just like burnt from that, like the way they did that. So unfortunate, it happens. And so hopefully somebody that's used to and comfortable with it. Canu Lane Skin Therapy is saying, have you tried Aerolase? What is your opinion on it for acne, rosacea, melasma? I think it's okay. I think that it's a short wavelength. Typically doesn't overheat the skin, which is nice. It's sort of more of like a jack of all trades type of thing, but I think that the wavelength can kill surface the bacteria there. It can also help a little bit with mildly with melasma. But you could tell I kind of think that there's better options out there for each of those things. So I usually don't go with jack of all trades type of things. Like I myself don't view myself as a jack of all trades. I try to just focus on a few things and do it really, really well. I don't try to do a bunch of stuff because I just want to make sure whatever whatever I do, I could do really, really well. And so that's what I view my lasers as. Like I view like lasers as also like that, like as a person. I want it to just be like the best at what it does. So I have like one device sometimes of each company, because it's like I think that company only made that device, and I actually got tricked sometimes because I assumed that this device was so good that these guys really know how to make energy devices and lasers. Let me go buy another device from them, and then it's like, whoa. That other device was terrible, actually. And I'm just going to stick with that one device that they had. Problem is that like a lot of people, they stick with the companies. You know, one of the doctors near us, he spent $1.5 million on a company's products of all these lasers and energy devices. And his skin type, the patient's skin type that he has, wouldn't even be treated with those lasers and energy devices. So they totally, just abused him. And it's really unfortunate. So it's like, for me, I try to just go with what patients need. So I get the device for each of my skin types that I treat. That's what I do. I just like, it doesn't matter to me what company it is. I try to just get the exact one that's best for this patient and the skin condition we're trying to treat. Do you prefer holistic ways of healing acne or medication? Yeah, of course. We want to look at everything inside out. We want to look at diet. We want to look at just the overall lifestyles. I do tell patients you are going to get better results if you lose weight. You happen to lose weight before this too. It'll be really good if your weight then is more steady as we're going about this process. I don't want you to have rapid weight loss afterwards, but like beforehand, get your weight to where you want it to be, and then we could go ahead and do this. Really try to get it optimized. Appreciate you, Megan. Thank you so much. That's really appreciated too, especially because it was a really great long day. Did a bunch of procedures today, really cool procedures actually. This one patient, I had done subcision on her before, and today she had very, very thick scars. And so I had to use the ablative CO2 laser and really took a lot of work to smooth it down as much as I could. And it was like just like each individual bit of that, and it was really amazing. And it's like one aspect that I love, you could use like a surgical piece of the laser, and it could go down to like 1 millimeter and just smooth down. Like just imagine for some patients where it's a raised scar, but it's like a little tiny line that's raised, you could just do that, and you could do it that way. Thank you, I appreciate it. I have no eye bags apparently. But I do have a little bit of under eye hollowness, and I accept it, honestly. That's one thing about me, is that it's like sort of like I accept certain things. It's just like, I think you're going to feel like it's really great in life when you accept certain things. And it's like, for me, I just try to be like the best version of myself. That's what I want to do. I don't want to look like somebody else. I don't want to like do something else. I just want to have like the best possible version for myself. That's what I want in life. And so it's like really nice. And like, I just want to like look at myself and like, that's what I am. It's like, just like, this was what I envisioned myself to be if like, such and such thing didn't happen. If I didn't have like a rapid weight loss at one point, if I didn't have scars, things like that, whatever it was, it's like, I want to like kind of get back to that portion of it, get back to myself at that point. So that's how I am. So it's like, like there are little things that like sometimes look at, I'm like, oh, it's like, I wish like this thing was like, I have like this little chickenpox scar on my forehead, oh, it's like kind of visible right now in this thing. And it's like, honestly, it doesn't matter that much. So it's like, it's okay. And it's like, when I look at like, remind my 16-year-old self what has happened in my life at this point. And it's like really cool, when you look at it, like, it's just like back when I had terrible skin, and it was like, felt really uncomfortable. It was also like interesting because I kind of had like, I was in middle school, I was like really, really tall, like taller than everybody else really fast. And so you just feel like there was like almost like this awkwardness. And then it turns out like you realize in adulthood that like, it's really great to like, just like, look at it and you've gotten to where you need to be, and like you've gotten the best version of yourself. It's like really fun. So it'll be like really nice just to remind yourself sometimes of like, okay, like if you're looking at a photo right now when you're like 70 years old, aren't you going to look and say that, man, you were like awesome at that age? Like just remember how cool it was back then. So that's sometimes what you have to like kind of remind yourself of, like just look at yourself and just like be grateful about things and like have a lot more gratitude with other things. And so that's what, honestly, I started like viewing that world, and it's like, it just helped a ton. Just like having gratitude and where you are in life. It's like, it's really, really amazing. And I feel like you could do that with almost anything. It's like almost like, or even if it's like the worst possible situation, there's some aspect of it and you're looking back and you're like, there's some aspects of this that like maybe I would never have experienced this if I didn't go through this, and maybe there's going to be something that's going to be amazing for us out of it. I don't know. There's a guy I follow, actually. He's a really nice guy. At some point, you guys should take a look at him. His name is Yassine. He was sitting there. He's in northern Gaza, and he's always talking on here, and he goes live and things like that. He says like Yassine, and I'm not recorded. I'm high. I'm live. But anyways, he's on TikTok, and like it's amazing to me that everything this guy is going through, and sometimes he is like very, very sad, things like that, but he still does, have like this positive attitude and like just like views things as like gonna get better one day. And he's sitting in the worst situation on the planet, and he's like, there's something that's going to get better one day. And it's like, if this guy can have that attitude, it's like, I think we should all have that attitude in life, that things are going to get better. Like, we do look like, it does look like it's pretty bleak, but like, there's a way like we could go through with this, and like, we're all going to be better for it. And it's going to be really cool. Because like, maybe it was good that like I did suffer from scars and from like acne and all that stuff. Maybe it was good. Like maybe there was a thing for that. Like it was like actually like something that was a positive thing. Maybe it did help that I wasn't like the most popular person in high school, and like I wasn't the most popular person in middle school, things like that. Maybe it was good that like I just sort of like helped out and like looked at people and tried to see like why were some people bullied and things like that, and like just observed from that vantage point. And it was like, okay, this is the reason why, and there's certain barriers here that maybe we should try to help out these people, and there's something that we could do to improve people's confidence in there, and it's pretty cool. Like that we could end up doing that someday, and like that's ultimately what ended up happening, because I was like kind of in that outside of like that super popular crowd there. Thumbs up saying, will tretinoin help pockmarks at all on Asian Pacific Islander skin? I want to book a consultation. Yeah, it could. It could be a great option. Just do a low dose of that, but I don't think it's gonna be enough, to be honest with you. If it was, I think everybody would realize that too. Let's see here. Do you use all TCA Cross treatments and other treatments? If not, how can I request to get you? I do all the scar treatments. I do all of it. I do have somebody who's training. She's going to be probably right. She'll be ready next year, but the year after that. So at some point she'll also be able to do things. Yeah, I do all scar treatments really from start to finish. Cannoli Skin Therapy saying, I've been doing TCA Cross and Skin Pen for acne scars and having a difficult time finding doctors here that are skilled with other modalities that I could partner with. You were in Hawaii. Appreciate you, Cannoli. We could talk at some point. We could see what options you could do to kind of improve that, though, over in Hawaii for patients there. Let's see here. Anyone know where I'm located? I'm in Newport Beach, California. All right, guys, I appreciate you so much. I'll be on again tomorrow night. Hopefully, if you have any questions, you could reach out to me. I had a bunch of questions about fillers over the weekend, so I just did that for today. But if you have any other questions, let me know and just message me. Thank you, guys. Take care.